Good morning, and thank you for joining us for this webinar on COVID-19 guidance for early learning and care contractors. This webinar is being presented by the California Department of Education's Early Learning and Care Division and Fiscal and Administrative Services Division with special guests from the California Department of Social Services. This webinar is being held on April 16th, 2021, and is scheduled to run from 10 a.m. until 11 a.m. We want to thank you for taking some time to join us for this morning's webinar. My name is Stephen Profiter. I'm the Director of the Early Learning and Care Division at the California Department of Education. Today's webinar is full of new and valuable information. We have also several individuals from the Department of Social Services joining us today, as well as our usual team to help make this webinar a success. With that, before I go any further, I'd like to hand it over to Dr. Lupe Jaime Milam.
Good morning, everyone, and welcome to the webinar. We're excited to be here and join our CDE partners and friends to answer any questions and continue to partner with all of you. I am Lupe Jaime Milam, and I'm the Deputy Director of Child Care and Development Division for California Department of Social Services. I, along with my colleagues, are continuing to partner with CDE on this webinar. Here with me today are Jennifer Hernandez from the FEED, which, as we know, July 1st, our CACFP program will be shifting under FEED. Jigna Shaw and Rachel Skews, who are from our CalWORK Stage 1 and Bridge, and along is our friends from Community Care Licensing, Shauna and Melanie. Back to Steve now.
Thank you, Lupe. We're so glad that you and the team are joining this morning. Because we have a lot of content to go through this morning, I'm also going to keep my remarks brief. And I'd like to kind of focus on one thing before we kind of get into the webinar. Earlier this week, another Black person was senselessly killed. Too many families have lost a son, a daughter, a sister, a brother, a nephew, a niece, an aunt, or an uncle to senseless violence. Daunte Wright's life mattered, and it ended too soon. Sorry, I just need to take a moment to compose myself, but bringing us back to the webinar, we have a lot to go get to this morning, which I'll touch on in an upcoming slide. But for now, I'm going to go ahead and ask Virginia to go ahead and join us for some items here.
Thanks, Steve, and good morning, everyone. So nice to be here with all of you today. Those of you who don't know me, I'm Virginia Early, the administrator of our policy office. I get to work on all guidance. Today, I'm more in the answering questions role. So looking forward to hearing what all of your questions are, and I'll turn it now over to our moderator for today, Alana.
Good morning, everyone. I'll be the moderator today for the webinar. I am a child development consultant in the policy office, and my name is Alana Andrade. Beyond me and Virginia, we also have a great team answering questions and making this presentation run smoothly for you today. Also from the policy office, we have Danielle Davis and Barbara Lindsay. From the Program Quality Implementation Office, PQI, we have Megan Jones, Mignon Pollard, Deborah Rawson, Lupe Lopez, Cassandra Lewis, Brittany Sheffield, Xier Zong, Richard Miller, Serene Yi, Christina Tony, and Katina Boulay. From the Child Development, Nutrition, and Fiscal Services, CDNFS, we have Andrea Johnson and Corey Kahn. From the Child Development Management Information System, CDMIS, we have Carly Nodahara. And to answer any questions regarding nutrition or the food programs, we have Shashi Sharma. We also have Shauna Wynn Swan and Melanie White from the California Department of Social Services, a child care licensing, to answer any questions that pertain to cohort guidance and licensing. And finally, we have Jigna Shah and Rachel Skews from CDSS as well to help answer any questions related to the transition. As usual, our team is committed to being as responsive as possible. And just to reiterate, the team will not be able to answer every question that we receive today. We do appreciate being able to engage with you in such a quick way. Also, the chat box is disabled. We will be able to share links with you, and the fabulous Brittany will be doing that through the chat, but you are unable to chat with us. So please utilize the Q&A feature to ask us questions. Now back to you, Stephen, for the agenda.
Great, thank you, Alana. So as you can see from the agenda up on our screen, and as we normally do, we have many things to cover. So first up, Lupe and I will discuss a couple of items on the transition to CDSS. Next, I'll provide some details regarding a two-part webinar that was about information about which was sent in an announcement on the listserv this morning to subscribers of the ELCD distribution list. We also have some guidance for a couple management bulletins that will be released very, very soon. Our fiscal team will be discussing changes to general childcare contracts and reporting. And the PQI team will update us on the program self-evaluation as well as documents needed related to that. After, we'll cover some questions that have come into the ELCD emergency email box. We'll do our best to address as many as we can. As we do each morning, as Alana just mentioned, please use the Q&A function in Zoom to share your questions. And as always, anything we don't get to this morning, we will take back either to other folks who may not be on this webinar that have expertise, or we'll post in an FAQ on our website. Perfect, thank you. So for this next part here, we've heard from many of you about some of the concerns you have related to the transition and how things will look July 1 and beyond. While we're working through some items and don't have fully complete answers, many of you have also asked for some certainty about items, where we have it. We thought we'd take some time this morning as both CDE and CDSS to provide you with some of those items. And I'd like to hand off to Lupe to review some of the contract items.
Yeah, thank you, Steve. And we're going to be tag teaming for this update on some assurances. So the first piece is in regards to contracts. So initial fiscal year 2021-22 contract processing. CDE is in the process of developing the fiscal year 21-22 contracts for contracts moving to CDSS and for contracts remaining at CDE. This process will be no different than a prior year. Contractors should expect to receive their initial contracts on or before June 1st, 2021 from the CDE Contracts Office. When contracts are sent, we will include instructions on where to return the contracts. Next piece is discussion on changes for fiscal year 21-22 contracts. While there will be no changes to the issuance of initial contracts, CDE and CDSS are both looking at opportunities to streamline the administrative processes, both for contractors and at the state level, which will then in return help to move the contracts and payments more quickly. We are working together to keep our ongoing processes as similar as possible so to not cause any confusion. We're looking forward to sharing more on this in this upcoming months. And then the last piece on my piece is funding terms and conditions. So the famous FTCs for early learning and care require, as you're aware, approval from DGS and DOF. Annually, CDE submits a package for approval in March for the preceding fiscal year. This year, CDE provided CDSS with a package for input and subsequently submitted the FTE package to DGS and DOF within the same time frame as the past years. As a reminder, funding terms and conditions are a combination of federal and state laws and regulations and are updated each year to ensure that they capture any changes in federal and state laws. The FTEs that will be published by June 1st will be structured the same way as they currently are in the previous years and will incorporate any changes to law as necessary. So I'm going to go ahead and hand it back to Steve to cover some of the reporting items.
Great. Thank you, Lupe. We know that many of you have asked questions, not just about contracts, but also reporting. So we'll touch on some of the reporting items here. So early learning and care contractors that hold either a CSPP, CCTR, CMIG, or CHAN contract currently report enrollment and expenditure data into CPARIS, which in turn then kind of determines payment to the contractor. And similarly for CAP, for CMAPs, or for CFCC, for the CalWORKS contracts, contractors submit caseload and expenditure data into the AP CalWORKS database, which also in turn helps to determine payment to the contractor. So CDE and CDSS are in the process of entering into an agreement, which will allow CDSS to utilize CDE's system, thereby kind of maintaining a single point of entry for contractors that have contracts across both departments. We're also working on an agreement so that CDSS contractors can continue to report enrollment data within CDMIS, as this data is required for federal reporting purposes, which CDSS will be responsible for after July 1. So as we're working on these plans, contractors can expect to continue to report in this system in next fiscal year. And with that said, both departments are working together to determine any necessary updates to all the applicable data systems to work through legal requirements, both either at state or federal level, given the split in administrative lead or transition rather in administrative lead of childcare programs from CDE to CDSS. As we get more information that might require changes to practices on reporting, we will certainly update them and make sure that you all are aware of those changes before they occur. One item here on the child and adult care food program. So child nutrition program sponsors report meals into a web-based system called the CNIPS, the Child Nutrition Information and Payment System. And this system is also used to determine payments to sponsors. But in addition to payments, many of you know that CNIPS is also used for programmatic updates, including the annual updates and other application-related documents. CACFP sponsors can expect to continue to use this system as they currently do, as the CDE and CDSS are also working on an agreement to ensure minimal disruption to CACFP sponsors. As with the early learning and care systems, both departments are working together to determine any necessary updates to data systems to again address the legal requirements given the change in the administrative lead for the CACFP. And of course, as we get more information, we'll make sure that, or more information that impacts reporting, we'll make sure that you have that information before changes occur. And if we can move to the next slide here, something of a rarity. I've got multiple slides this morning. I mentioned an upcoming webinar series in a previous webinar, and I'm happy to give you an update this morning. If you're a subscriber to the ELCD's distribution list, you should have seen this information this morning through the Deputy Superintendent of the Opportunities for All branch. So the CDE is presenting a two-part webinar series titled Creating Brave Spaces in Early Childhood. The first in the series is scheduled for April 26th, so please mark your calendars, from 6 p.m. to 8 p.m. and we'll discuss strategies to interrupt and counteract bias, racism, and hate. Teachers, administrators, and parents are invited to join us for a deep, courageous conversation about the impacts of bias, racism, and hate on young children, their families, and on early childhood education. Come join and hear compelling research, stories, and strategies, and lay plans to support, guide, or inspire your own journey to understand implicit bias and to disrupt racism and hate. The second webinar in the Creating Brave Spaces in Early Childhood series is scheduled for May 10th, 2021 from 6 p.m. to 8 p.m. and we'll discuss how excluding, suspending, and expelling hurts children. Please return for the second session of this collective discourse to, intended to create systemic impact with the California State Superintendent of Public Instruction, Tony Thurmond, moderator Senta Green, and panelists Dr. Walter Gilliam, Maurice Sykes, Nadia Haboneta, Dr. Tanette Powell, and Khadijah Johnson as they unpack exclusion, suspension, and expulsion in early childhood education, how children of color are disproportionately affected, and how we can begin to recognize, talk about, and create change in dispositions, behaviors, and systems to meet the needs of all young children. And I see Brittany dropped the link into the chat. Thank you very much. So to register for this webinar, please visit, I'm going to read out the link here. It's https://surveys.go/CBS-webinar-registration.asp. And I'm going to wrap this slide up and hand over to Crystal to discuss a couple of management bulletins.
Thank you, Steve, and good morning, everyone. So some good news, Management Bulletin 21-06 will be released sometime today. This Management Bulletin updates MB 20-15 and 20-15A, which will remain in effect, and provides updated reimbursement requirements for alternative payment programs and providers. This updated guidance is for CAPP, C2AP, C3AP, and CMAP contractors regarding reimbursement to providers for up to an additional 16 non-operational days for closures related to COVID-19 as authorized by Assembly Bill 82. These 16 non-operational days for closures related to COVID-19 are in addition to the 14 non-operational days previously authorized by Senate Bill 820, and providers are required to indicate on their invoice or attendance record any days of non-operation due to a COVID-19 related closure. Providers are also eligible for the 10 non-operational days authorized in statute. Therefore, providers are eligible to be reimbursed for a total of 40 non-operational days during fiscal year 2020-21. Next slide, please. So more great news, Management Bulletin 21-07, updated reopening and reimbursement requirements for direct service contractors will be released later today and will rescind and replace Management Bulletin 20-18. All updated guidance in this Management Bulletin is in bold lettering for ease of locating the updated requirements, and all other guidance in this Management Bulletin that is not in bold lettering is aligned to the guidance previously issued in Management Bulletin 2018. We've put this in the same Management Bulletin since we wanted all guidance related to closures for Fitchens in the same place. Management Bulletin 21-07 provides updated guidance to direct service CFCC contractors and CCTR, CSPP, and CMIG contractors who provide services through a family child care home education network regarding reimbursement to providers for up to 30 non-operational days for closures related to COVID-19 as authorized by Assembly Bill 82. These other days for closures related to COVID-19 these other COVID-19 related non-operational days are for when the provider needs to close, but not due to a public health order or guidance related to COVID-19 and specific to early learning and childcare that requires closures. Providers are required to indicate on the attendance record or invoice any non-operational days for other closures related to COVID-19. This policy is effective September 1st, 2020 through June 30th, 2021. The ELCD recognizes the legislative directive is retroactive in nature, and some providers may have already had closures related to COVID-19 prior to the signing of AB 82. This may require contractors to process adjustments that were not previously reimbursed for non-operational days of closure for closures related to COVID-19 that were not claimed by providers since September 1st, 2020. Contractors must notify providers of the retroactive legislative directive and provide them with the option of requesting an adjustment to be reimbursed for retroactive closures related to COVID-19 for which they were not previously reimbursed. The ELCD strongly encourages contractors to process these adjustments as quickly as possible, but no later than June 30th, 2021. This MB also provides additional updated guidance on contractor requirements for reporting the use of the non-operational days of closure. And I'll now hand it over to Corey to give us a fiscal update on reporting for these non-operational days.
Thanks, Crystal. So as Crystal said, I'm going to go over just briefly the reporting requirements that's stated in Management Bulletin 2106 and 2107 that she just went over. So stage 2, stage 3, CAP, CMAP, CCTR, CSPP, and CMIG contractors who provide service through a family child care home education network will be required to report the use of the 30 non-operational days for closure related to COVID-19 and the associated costs when the primary provider is closed and the child receives care from an alternate provider. So non-operational days for closure related to COVID-19 should only be reported if the closure was related to COVID-19 and not due to local or state public health order. So now what's different is CCTR, CSPP, and CMIG contractors who do provide service through a family child care home education network are now required to report to the CDE through the Child Development Provider Accounting Reporting Information System, also known as CPARIS. And CFCC contractors actually will report this data through the Alternative Payment and CalWORKS online reporting system. So stage 2, stage 3, CAPP, and CMAP contractors since September 1st has been reporting any non-operational days related to closure. And so they will continue to report the non-operational days through the AP CalWORKS online reporting website. But they now have up to 30 days to report instead of the 14 that was originally provided in a previous management bulletin. So the data that will be required to be reported is the number of children requiring care from an alternate provider. You'll be required to sum all of the days the children receive care from that alternate provider, and then also the total cost associated with paying the alternate provider due to the primary provider's closure. So we will use this information to determine the contract earnings and reimbursement. And because of this, because this is a new data requirement for CCTR, CSPP, CMIG, and CFCC contractors, the Child Development and Nutrition Fiscal Services will be hosting a brief webinar at the end of this month, specifically for CCTR, CSPP, CMIG, and CFCC contractors to take any questions that you may have. We are still working on scheduling that, so please be on the lookout for an email announcing the webinar related to reporting these non-operational days in the next week or so. So now I'm going to move away from the management bulletin reporting, but I'm going to go over a few fiscal updates. And the first update that I wanted to discuss was in regards to changes to the intra-agency CCTR CSPP transfer and the voluntary temporary transfer period. So the CDE released an email on Tuesday, and it was titled Changes to Fiscal Year 2021 General Child Care CCTR / California State Preschool CSPP Intra-Agency Transfer and Voluntary Temporary Transfer period. And we released that to those subscribed to the Early Learning and Care email distribution. And so this email informed contractors that the CDE would be moving the spring CCTR CSPP intra-agency transfer along with the voluntary temporary transfer, which we sometimes in short say VTT. So we were moving those application periods up a few weeks, and I did say this a couple weeks ago on the last webinar. And so this is specific to fiscal year 2021. So typically, the two transfer periods, both for CCTR, CSPP, intra-agency transfers, and VTTs, typically those are submitted between May 1st and May 15th. However, for this fiscal year, the CDE will be accepting requests between April 15th and April 30th. So this is going to help ensure that contract amendments for all intra-agency transfers and VTT approvals are processed prior to the end of the fiscal year. And so just a little note that was also included in the listserv was that CCTR CSPP intra-agency transfer request will be submitted through the Child Development Provider Accounting Reporting Information System, also known as CPARIS. And VTT requests are coordinated by the Local Planning Council, or LPC. They are not submitted through CPARIS. And so contractors, what they'll want to do is, if you believe that you are over or under earning your contract for fiscal year 2021, you'll indicate your willingness to participate to the LPC designee or subcommittee and provide the amount of contract funding that you expect to temporarily release or accept in this fiscal year. So again, this is not through CPARIS. You'll coordinate it with your LPC. Any contractor participating in the VTT process will be required to submit a form agreeing to the terms of this temporary relinquishment or accepting of funding. And you can submit it electronically with an electronic signature. So for more information, you can refer to the email that was released on Tuesday or contact your Child Development and Nutrition Fiscal Services fiscal analyst. And then the second update that I wanted to provide was in regards to stipends. So next slide, please. Can we go to the next slide? Hopefully, yes. Okay, thank you. So the CDE released a second email on Tuesday, and we titled it Assembly Bill 82 Stipend Update to those subscribed to the Early Learning and Care distribution list. This email provided an update to contractors about the Coronavirus Response and Relief Supplemental Appropriation Act, also known as CRRSA. And it talked about, the stipend funds that were allocated to pursuant to Assembly Bill 82. So as an update, so the State Controller's Office did process checks for the CRRSA stipend allocations on Friday, April 9th, and mailed them to contractors on Monday, April 12th. We've actually heard from a few contractors that they have begun to receive their checks in the mail. So I do know that it's starting to be dispersed to everyone. And as a reminder, funds provided via an apportionment payment to LEAs or local education agencies, including charter schools, must be distributed through the county treasurer's office. And LEAs should therefore contact their county treasury office to coordinate the transfer of funds. These funds included in this email, or actually it's not in the email, but these funds can be used for allowable obligations incurred between July 1st, 2020 and June 30th, 2022 to prevent, prepare for, and respond to the COVID-19 pandemic. Meaning, if you incurred expenses due to the pandemic prior to receiving these funds, you can use these funds to offset costs back to July 1st, 2020. The CDE has also been receiving questions about the project cost account, or PCA, and the standardized account code structure, or what we call SACS code, related to the CRRSA stipends. So while the CARES stipends, the ones that were distributed back, I believe back in December, had different PCAs and reference codes for each contract type, the CRRSA stipends are all paid from the same PCA and have the same SACS resource code. So on the screen, for contract types, for all contract types who receive the CRRSA stipends, the PCA is 15555 and the SACS resource code is 5058. You can always contact your fiscal analyst if you need more information or need that PCA again. So now I'm going to turn it over to Megan, who will discuss the program self-evaluation requirements.
Thank you, Corey. The PQI team would like to thank everyone who attended the program self-evaluation webinar on Wednesday and for your active engagement throughout the presentation. It was phenomenal to hear the strategies and practices you've adopted during COVID that you will continue to use going forward, as well as the goals you have set for the year ahead. We are working to get the presentation posted to the PSE webpage as soon as possible. We had some reoccurring questions that we wanted to briefly address this morning. First was regarding the submission requirements for this year. As you know, the traditional form was replaced with a multiple choice survey, the ELCD 4000M survey. The submission requirements for the survey are detailed in this table. Whether you are open and providing in-person services, are operating in a hybrid setting where there's a combination of in-person learning and distance learning, or if you are closed and providing distance learning services only, you are required to submit one survey per contractor. Regardless of the number of contract types you hold, one survey per contractor is required. The survey is due June 1, 2021 by 5 p.m. The ELCD 4000M survey is located on the PSE webpage. Complete and submit directly through the survey link. Brittany, if you could please drop the link to the PSE webpage into the chat. Next slide, please. The second item that came up was the required documentation that is kept on site. Again, whether you are open, operating in a hybrid setting, or only providing distance learning, the use of the program review instrument and the applicable parent survey are required. If you are a direct service contractor, in addition to the program review instrument and parent survey, the desired results developmental profile, or DRDP, is required. If you are completing an environment self-certification in lieu of an ERS assessment, you will follow the guidance described in this table. If at any time throughout the year your agency was open or operating in a hybrid setting, you must complete a minimum of one environment self-certification per direct service contract type held. If you were closed for the entire year and did not offer any in-person services for the entire fiscal year, you are not required to complete the environment self-certification. One last reminder, all required backup documentation is kept on site and not submitted to CDE. Thank you again for your active participation at the PSE webinar. Over to you, Alana.
Well, that was definitely a lot of information. Thank you everyone for utilizing the Q&A feature. A lot of our staff have been able to respond to your questions, and we have flagged several that we want to make sure are addressed out loud as they were asked repeatedly, and which makes it a frequently asked question. So I would like to first talk, sorry, I took a screenshot to make sure I could read this out loud. So there is a question about distance learning, and since some schools are reopening, and with that, some parents are still wanting to keep their children at homeschooling. So there's a question, and I would recall on either Roseanne for our PQI admin. We are a school district's part day CSPP. The district is indicating that K-12 may possibly offer distance learning as an option in 2021, 2022, in addition to the full reopening schedule. Will our CSPP program also need to offer distance learning in addition to the in-person program for families that request it?
Good morning, Alana. This is
Good morning.
Roseanne. We haven't made a decision on that yet, so we'll take that question back and we will get an answer as soon as we can.
Excellent. Thank you, Roseanne. There's a few other questions that I flagged. I'd like to invite Virginia. So there's a lot of questions about Assembly Bill 22 and how it might indicate in the future of the state preschool program. Can you speak a bit to that, please?
Yes, happy to. Thank you, Alana. There are a lot of questions about AB 22, and so I want to share with everyone that AB 22 is still a proposal. It's not the law. And so as such, the legislature has an open process that is accessible to the public for the public to provide any comments, concerns, questions. And so I just want to flag that. So if there are thoughts that you have that you think need to be part of the conversation around AB 22, we would urge you and anyone else who has those same concerns to reach out to the member's office who's authoring the bill. Also, reaching out to the members that are on the education policy committees in both the Senate and the Assembly, the Senate and the Assembly appropriations committees. And then, if you're also concerned about the governor's budget proposals around transitional kindergarten, reaching out to the budget committees as well as the governor and Department of Finance. So I know that's a very long list of folks, but we really want to share with you that these are still ideas that are sort of taking shape and aren't law yet. And there are processes by which folks can provide input and feedback that folks that can inform what's going forward. So, many bills are introduced in the legislature each year that pass and are signed by the governor, and many bills are introduced and make it through part, and the ideas are sort of mulled over and they're considered for another year or modified going forward. So I think we don't know yet what's going to happen on AB 22. I do want to clarify one piece is that our current read of the bill is that it doesn't eliminate CSPP. It would allow parents to choose between CSPP and TK. So I just want to throw that out there, if that helps. But we're also in the process of reviewing and analyzing the bill to see, sort of to make sure we understand the effect that it's going to have on the system and what CDE would need to implement it if it were to pass. So we know there are a lot of questions and concerns there, but really want to help empower you all to share it with those that are making the law as they consider how to make that law.
Thank you for the very full answer. That was definitely a hot topic on the Q&A feature today. So Virginia, I would like you to stay on. There are some questions about hold harmless, and I think one has been flagged. When do we know if CDE is going to have a hold harmless clause again for 2020-22 for the CSPP contracts?
Yeah, thank you, Alana. And for those of you that asked that question, that's a great question. We don't yet know when we'll know. So I think there are a couple of key points in the legislative calendar where there are opportunities to have something added. As we've shared before, current law says that the direct contract hold harmless, where folks are being paid at costs, regardless of attendance, if you're a direct contract, those pieces currently are set to end based on what's in statute on after June 30th. However, we know that we've brought it up in every single budget hearing we've been part of at CDE to stress the urgency of extending hold harmless provisions, both for our direct contract providers and for voucher providers. So we're hopeful that there will be movement on this. The next sort of spot where something is most likely to happen is in the May revision. So the governor by May 15th will be releasing an updated version of his budget proposal, and we'll know a lot more then about what he's thinking would go in, and we'll be definitely reviewing that proposal very carefully to see what is in there regarding extending the hold harmless. That being said, if it's not in there, it doesn't mean the legislature won't add it in themselves. So we'll be closely monitoring budget hearings that will happen right after the May revision is released to sort of continue to elevate the importance of that from the field as we have at the previous budget hearing so far. Now, that's all to say this is pure speculation, so it's really hard to say exactly when we'll know, but I would urge all of you to continue reaching out to legislators, to their staff, to the governor administration about the importance of this issue to you, because that's going to influence that conversation. And who knows, maybe they would decide to do something earlier than May 15th. It's really hard to say. So we just unfortunately don't have a great answer, but now you know what we know, which is that we have some speculation, but don't have all the answers.
Thank you, Virginia. So I would like to invite one of our DSS partners to speak. There was a question regarding the release of contracts, so I'd like to ask Jigna. So there were some folks who asked about repeating the date when they would expect to see contracts from DSS.
Yes, I believe the answer is June 1st of 2021. It should not change. That date should not change.
Excellent, thank you. There are a few questions regarding stipends, and several folks have also shared that they received theirs, which is wonderful. Let's see if there's one. So Corey, I'd like you to come back, and there's been some questions about what information should be shared to the providers to get their stipend funds. Are there any forms that they need to fill out? Things like that.
So we don't have any forms, like preset forms per se, that we drafted. That was consistent with the first round as well. I would say, I mean, it's $525 per child. That was based on your November report. So if it's helpful for the providers to know, like, you know, I received X amount of dollars, why, you could probably provide them with, you know, the breakdown, the count of kids, and then times 525, but I don't think there's really a requirement per se.
Okay, thank you. There's another question, Corey. So one was, can I use the 5% admin funds from the CURSA stipend for hazardous pay for staff?
So the 5% admin is specifically related to like issuing the stipends. And so, I mean, if the hazardous pay would qualify for that, I guess so, but I think, I mean, in general, the 5% is really just to cover your admin costs that were associated with issuing the stipends.
Okay,
Hi,
thank
can
you.
I clarify that, Alana? This is Andrea Johnson. So depending on the contract type of who asked the question, they may have, you know, a different situation because we have AP type contractors that receive the 5% admin, and we also have our direct service type contractors. Hazardous pay, if you refer back to the Assembly Bill 82 stipend guidance that was issued on March 25th, we do specify that hazardous pay is an allowable cost for this purpose. And that is true for both AP type contractors and also for the direct service type contractors. There's a little more information in that communication because we do still have to follow the federal regulations that are specified in that communication. So I would refer back to that. If you need a copy of that, if you didn't receive the communication, you can also reach out to your fiscal analyst and we can forward that to you so that you have the information.
So Andrea, I have a follow-up question. So there are some folks who are asking about the math that they did, what they assumed a stipend would be versus what they received. If they have questions, who should they reach out to?
The fiscal analyst can provide that as well. I don't know if we shared in this webinar, but I know we've shared in webinars that we used the information submitted in CDMIS for direct service contractors. So that's, you know, CCTR, CSPP, CMIG, CHON, and CFCC. And then the AP type contractors, we use caseload that was reported by the contractor into the CalWORKS and AP system online. So it should just be exactly what you reported times $525. And as Corey shared, we are in the process of working through the data that was submitted for those, you know, families that receive care from more than one provider. So if you need more information on that, you can also reach out. But for the first stipend you received, it should be very straightforward, exactly what you reported, times the $525, and then times the 5% admin. But absolutely, if something, you know, if you have questions about that, please do reach out. We can provide back the information that we pulled from our system so that you can see exactly what we used.
Excellent, thank you. So there's not a question that I can tap into, but I'd like to invite Jigna and our DSS partners to speak if there's any other clarifying items that you'd like to share about the stage 1 stipends.
Sure. So the stage 1 stipends are a little bit different this time. So for counties that administer stage 1 in-house, checks are going to be cut by the Foundation for Community Colleges, for California Community Colleges. So that organization is going to be sending checks directly to the child care providers if a county administers stage 1 in-house. If a county subcontracts their administration of stage 1 to their local AP program, the Foundation for California Community Colleges will be cutting a check to the alternative payment program, who then in turn will be sending the checks directly to the providers. Does that make sense?
It makes sense to me, but
Yeah, and I just want to add one thing to those, that I can see a lot of people asking questions about stipends in the chat, and it's a little hard since the DSS stage 1 stipends are different from the CDE stipends to tell which one you're asking about, and we want to make sure that we're giving you the right information. So as you ask those questions, can you please clarify which programs you're covering with those stipends? That way Jigna knows if she needs to respond for stage 1, or our team at CDE knows if they need to respond for the other programs. That makes it a little more complicated, but we want to make sure that you have the right information.
Also, I can put in the chat box, I can put a link to the CDSS stipend website that explains the stipend process for stage 1 a little bit better. So I can add that to the chat.
Thanks, Drigna.
So Virginia, I'd like to also ask you about distance learning within the next fiscal year. There are some questions that are asking about the continuation and how that will look.
Yeah, so we've seen a lot of questions about this in the chat. So thank you to all of those who've raised that up to us. So we're currently starting to think through, obviously, there are some big question marks. Like I mentioned, we don't know what the law will be around the hold harmless, for example. And so while there are still a lot of question marks based on the sort of pending what will the legislature and the governor do, we're working on sort of areas where we do have pieces to make sure that we are working through what that guidance will be for state preschool after July 1. And so thanks for flagging this for us. It's definitely on our list to issue guidance on. We don't have an answer today, but stay tuned. And I'm sure as we have more information on that topic, we'll share it on our webinars and via our listserv and other guidance.
It seems like there are folks who are clarifying which contract they meant. Although with the Q&A feature, as wonderful as it is, we can't always read all the way up for when you first asked your question to when you're now clarifying what your contract is. But I think next time we do a webinar, I will also just give a PSA at the beginning, which is what we used to do, of please be very clear on which contract you're talking about. Okay, I know that we're running low on time. Let's see what we can speak on. A lot of these are coming in for very specific to specific contractors and specific programs. There is a question about a fetch-in provider and a CCTR contract. Can I ask that Corey come back for a moment, or Andrea? So if a contractor has a fetch-in and a CCTR contract, will the contractor required to pay the payment direct to the provider? And then how can we be assured that the payment can be used for the allowed expense?
So I would say that the payment gets sent to the fetch-in just as if all the other payments normally get sent to the fetch-in. So if you normally send it direct deposit to them, then that's an agency decision on how you pass it down to the fetch-in. But I would assume it's the same process as, providing them with the reimbursement. And then as for like what sort of documentation the contractor needs for determining whether they've spent the funds, or how they spent the funds, we're not requiring that the contractor collect receipts or anything from the fetch-in. So you as the contractor just has to have documentation on like how you distributed those funds.
Okay, thank you. It looks like there's some questions that are broken up. So we do ask that you take a moment to make sure your whole question has been typed in before you hit the submit button. That way we are able to actually answer your question instead of just getting bits and pieces. So while our team is continuing to respond in the Q&A feature, and I'll await the team to see if there's anything else that we can speak to out loud, but I'll let the team continue into the Q&A feature, and I'll ask that Barbara move the slide deck over so we can share some resources that we talked about earlier in the webinars. Thank you, Barbara. So the ELCD COVID-19 guidance webpage is where you can find webinar slides and transcriptions. You can also find our management bulletins and our frequently asked webpage, which has now almost 400 FAQs. It is a very good resource. I bookmark it. I hope that you do as well. The ELCD emergency inbox is a way where you can submit questions as well. And that is at the ELCD emergency at cde.ca.gov. Also, I forgot to read out our ELCD COVID-19 guidance webpage, and that can be found at https://www.cde.ca.gov/sp/re/ELCD COVID-19.asp. To reach your assigned PQI office regional consultant, please visit www.cde.ca.gov/www.cde.ci/assignments.asp. As usual, consultants are most easily reached by email, or you can also call 916-322-6233. I also see some questions popping in about the link for today's recording and the slide deck. So for CDE, we do have a process where we have to do a full transcription and also make it compliant for those were visual impaired and hearing impaireds. So it takes us a bit to get it on our webpage. So do be patient with that, and please be on our ELCD listserv. That way you'll be first to know when those recordings are posted. Next slide, please. I'd like to invite back Stephen to close out our website.
Wonderful. Thank you, Alana. I love the pictures in these webinars, and thanks to all of you who share them with us. So on behalf of the team here at CDE, and a thank you here to our guests from CDSS, where we continue to work to support children, families, and provider professionals. We thank you for taking time out of your day to join us for this morning's webinar. We do hope you'll join us for our next webinar, which is scheduled for April 30th, 2021, so about 2 weeks. A special thanks to Lupe and the team at CDSS for joining us this morning. We know the transition has created anxiety among many of you, and we will continue to share any information as soon as we can. And so with that, please take care of yourselves, take care of each other, and be kind. We can't wait to get back to normal, back to being in person. But until we get there, please remain vigilant and help stop the spread of the coronavirus. We will get back to normal, and we'll do it together. Thank you, and we hope to see you next time.